Can you see? Can you see my screen?
Yes, ma'am.
Okay. We'll start the class. Okay. Cancer biology. So, cell biology. What is cancer biology? So, in simple terms, I'll tell you what is cancer. Okay. What is cancer? You know something. Every time I used to tell this, you cut your hair, you cut your nails, you do different hairstyles, you do different beard shapes. You fall down, you get up, you injure yourself, but still you're not worried. Why? Because you cut your hair, it will grow. You cut your nails, shape your nails, put some permanent nail polish, do whatsoever, it will grow. You know that it is not stopping the growth. Even if you don't like it will come back. If you don't like one single nail polish and it's a permanent one, need not worry. Within few weeks, it will come back. If you cut your hair, you need not worry. That hairstyle is not good, you want a new hairstyle, you can get it done. Even if you fall down, you get a scratch, it will get healed. So no problem. But you're worried when your liver starts damaging, this problem to your heart, problem to your brain, all this. You're still not worried when there's a problem to your liver because you know that at least one option of liver transplantation is there. And even kidney, you have an option of kidney transplant if you are eligible for this both. But when something happens to your heart and when something happens to your brain, do you really worried when some part of the brain damages? What happens? It cannot be reversed. You can only prevent the further progression with the medications, but you cannot reverse the damage. When it happens to heart also, permanently you cannot reverse the side effects or whatever happens, the function, you cannot reverse it completely. Okay? Why? Because the skin cells, hair cells, all this keeps continuously, all this keeps continuously dividing. Okay? And when you see cancer cells, okay, the character of these cancer cells is similar to our normal cells. So they also keep dividing continuously. So they are also our body cells. These are also our body cells. Hai na? So what happens when both are our body cells? There will be similar characters, both, but these are useful cells, these are not useful cells. There will be some mutation at one point during your cell cycle, wherein which when the cell is passing from one phase to other phase, some changes will happen. And if they are not repaired, what will happen? The damaged cell will go under replication. It's same like a baby which is not completely developed in mother's womb, which will not have all the functions. Okay. The similarly, the cells are also same. So what the concept here is, you are getting the side effects because of the anti-cancer drugs, because of this thing, because both are your cells. Okay. You know the normal biology of cells. What happens? Cell cycle, one cell divides into two. This is what happens. But what happens to cancer cells? It will also divide into two, but they are not useful cells. And what will happen? They will divide very rapidly. The speed, everything is very fast. Okay? Understand this. See, little bit of history we will see. Hippocrates coined the term carcinoma for the cancer of breast. And so carcinoma means cancer. So the word cancer means crab. It is reflecting the true character of cancer since it stick to the part stubbornly like a crab. Okay, the cells will stick on. So like a crab, so stubbornly. See when a crab comes and bites with all its legs, how it will. So the cancer also looks similarly like that. So we tell cancer means crab. See here the shape, large number of prominent veins surrounding a growth, showing the picture of a crab wearing the claws. Okay. What is cancer? What we'll discuss about the development, growth, and spread of cancer and some risk factors. So it's a disease that occurs when abnormal or mutated cells form in the body and grow in an uncontrolled manner. I told you abnormal cells, mutated cells. This results in an abnormal growth, tumor developing, which causes damage as well. So, if it is growing overly, the cell is not dying, it is just growing. It is losing the dead signals. Then, what happens? It will go and press on the invading healthy body tissues and organs. It's similarly like in a normal bus, when people travel, if they're just sitting in the seats, it's fine, well and good. And because the bus numbers are less and people are more, what will happen? Extra people climb, they press over each other, and there will be so much of suffocation. There is no extra space. In that same space, the crowd becomes more. So what will happen? They keep pushing each other and keep fighting. Similarly, the character of cancer cells is also same, interrupting normal biological process and functioning of body systems. Usually there should be some flow. So if your cancer cells go and block some lymph vessels, lymph ducts, what will happen? The normal biological process will be disturbed. It will go and block some vessels. So other than your blood cells, abnormal cells also will be passing. So what will happen? There'll be some abnormal growth where something, so there'll be some abnormal growth in liver or the passage ducts somewhere. So it is disrupting the normal biological process or functions of the body systems. Okay. So neoplasm or tumor is a mass of tissue. See, please clearly understand. Okay. The meaning of these words formed as a result of abnormal, excessive, uncoordinated, autonomous, and purposeless proliferation of cells even after cessation of stimulus for growth which caused it. Means, even when stimulus is there, cells will have to divide. When there is no stimulus, there should not be any division. So understand the meaning of the words. See, abnormal. In the context of cancer, abnormal refers to cells that deviate from healthy cells. Okay. Typical appearance, in structure, and also in function. They bypass these regulatory mechanisms of the orderly process of growth, differentiation, and death. So they bypass these signals. So they often have mutations or alterations in the DNA. Okay, that is leading to that uncontrolled growth and division. What is the meaning of the word purposeless? Okay, purposeless means cancer cells exhibit purposeless growth, meaning their proliferation does not serve any constructive or functional purpose for the body, but they will cause harm. What will happen to normal cells? They divide and grow to replace the dead or damaged cells and support the bodily functions. But there is no, they don't serve any constructive effect or functionless purpose to the body. What is the word? Excessive growth. Excessive growth in cancer describes rapid and unchecked proliferation of cancer cells. They're like, unlike normal cells, which divide in a controlled and limited manner, cancer cells divide excessively, leading to the formation of tumors and the potential spread of cancer to other parts of the body. What is this meaning uncoordinated? Means they'll spread in an uncontrolled manner. There's no control. They lack the regulation and harmony seen in the normal tissue growth and disrupting this normal body functions. In cell growth and division of normal cells are highly controlled, tightly controlled and coordinated to maintain the tissue structure and function in healthy tissues. What will happen? There is some shape, everything for the normal body tissue. But in case of cancer cells, that is all disturbed. What is the meaning autonomous? Autonomous growth in cancer refers to the ability of the cancer cells to grow and divide independently of the normal regulatory mechanisms that control cell proliferation. You know that when cell growth happens, at certain limit, the signals will tell enough, the growth is enough, it's sufficient. So stop. So, but what will happen here? These cancer cells will acquire so many mutations. Because of that mutations, they can bypass these signals that normally regulate the cell growth and they will allow them to proliferate uncontrollably without regarding to body's needs or concerns. Imagine your liver grows in an abnormal cells. That is not normal, no? The same thing. I think you understood the meaning of these 5 words. Is it clear? Yes or no? See, you should understand the concepts to understand each and every cancer, okay? Okay. You have understood? We'll go. And the branch of science dealing with the study of neoplasms or tumors is called oncology. See, it's looking like a graph. Suppose if you think this is a primary tumor and metastasis cancer network. See, different systems. The cancer is spreading from the primary tumor that is called as metastasis. Okay. See, components of tumor. Tumor have two components, nothing but parenchyma and stroma. Parenchyma means all the cells is called as parenchyma. They are nothing but the proliferating tumor cells. Parenchyma determines the nature and evolution of tumor. See, what is this nature and evolution of the tumor? We will discuss what is the word meaning nature means, what is the meaning evolution means. See, sometimes have you ever heard when people tell, see, my mother got breast cancer and uh, it has already spread to the bones. It also have spread to the brain. How can you tell that breast cancer has spread to the brain, breast cancer has spread to the bones? When you take out the biopsy of the cell, okay, you will see the breast cells that have been growing there. The tumor that is present or the cells that are present, when you see under microscope, when pathologist sees them, he will tell you whether they're which cells, where they are present. If they're spreading to some lymph nodes, the metastasis happen to some lymph nodes. What will happen when you cut down the lymph and observe the pathology? It will show you the cells of breast. So that's how you understand where is the primary tumor in your body. Okay. Stroma means what? If you just have cells, that is enough. If you're not getting oxygen, can you live? You cannot live. So stroma is nothing but the fibrous connective tissue and blood vessels which will provide the framework on which the parenchymal tumor cells grow. See, if your normal cells need to grow, you need oxygen, you need everything. In the similar way, even your cancer cells need this oxygen and also nutrients to grow. So the stroma is nothing but the blood vessels that will be there, which are supplying these nutrients and oxygen to the cancer cells. So cancer can occur in any cell in the body. You may sometimes hear tumors being referred to as malignant or benign. It's important to know the difference. Cancer means it's a malignant tumor. Benign tumor is not cancerous, but it has a characteristic or it can become malignant. See, is there heart cancer? So many people will have doubt. Organs where this cancer is very rare or absent. See, in case of heart, it is very rare because your heart cells will not keep growing continuously. Very low cell turnover. Protected tissue. That is why it has a protected tissue. So, there will not be cancer, but there is a chance. Spleen, it's very rare, uncommon as it is not a primary site. Means spleen cancer you will not find, but you will see some other cancers spreading to spleen. And small intestine also very rare compared to the colon. Rapid cell shedding is there in small intestine, and it is having alkaline environment. So you will not see more cancers in small intestine. Nails and hair, but skin around the nails can have, okay, there can be cancer. They're made of dead keratin. And tooth enamel, there is no cancer because it's not a living tissue. So what is the difference between a malignant tumor and a benign tumor? Benign tumor, the cells look like the normal cells. See, when you go and when you observe these cells in the microscope, sometimes you feel, below your skin, there are some lumps kind of thing. Have you ever noticed that under your skin, there is something like, the small lump formation, the breast, under the skin, hands, and all these places? Have you guys, any one of you, have you ever noticed? Tell me. Have you ever noticed and got scared? Yeah, they are nothing but small, small lipomas, even the tummy part. All this you will be observing. Okay. When you see them under a microscope, when you see the normal cell, suppose you are seeing a breast cell, you have found some lump. So you have taken some cells from the lump of the breast and you have observed under the microscope. You will not find much difference between a normal breast cell and the cell which is in the lump. They look almost similar. They're non-cancerous. Capsulated means they have a defined border, they're slow growing, they do not invade into any other tissues, and they do not metastasize. And when you call about malignant tumor, they have larger and darker nuclei, abnormal shape, they're cancerous, non-capsulated, fast-growing, invasive, and metastasize. Okay, metastasis means they have chance of growing to going to other tissues through the blood. Okay, next one. Are you clear with this terminology, guys? Yes. No. Tell me, Khan Imamuddin, where are you not clear? Open your mic and ask me where are you not clear, because these concepts are very much important. See, ma'am, tell you capsulated means it is having a defined border. Okay, defined border means benign tumors are easily operable. You can operate and remove it when it is not protruding or invading into other tissues. But when you want to operate this, don't have a clear border. You have to shrink the tumor and then operate. Okay. And fast growing means when malignant means what multiple mutations have happened. So the growth will be very fast. The cell replication will be very fast. Okay. That is what it is. Hope you are clear. Yeah. Now we'll see some characteristics of the tumor. Only not normal cells. See, you will see, simply you will understand, okay? A spoiled kid and a very good. There is no spoiled kid, just the habits. All are kids, but a spoiled kid means more naughty, extra naughty, means hyperactive, everything. He is not normal because of his behavior and attitude. So what are those behavior and attitude of these tumor cells when compared with normal cells? Okay. When you see the rate of growth, okay, the rate at which the tumor enlarges, okay, the rate at which, rate means how fast the tumor will become big, okay, how many cells it will produce, the rate, how many times it will divide, okay, depends on two main factors. They're nothing but rate of cell production, growth fraction, and the rate of cell loss, degree of differentiation of the tumor. Okay, what is this rate of cell production, growth fraction, and rate of cell loss? The rate of growth of a tumor, it depends on three main parameters. Okay, what are the three main parameters? Doubling time of tumor cells. See, doubling time of tumor cells means, suppose if a normal cell takes 1 minute to divide into two, what will in cancer, what will happen? For a cell to divide, it will take only 15 seconds, 30 seconds, means less than the normal cells. That is nothing but doubling time of tumor cells. Another one is there, okay, number of cells remaining in the proliferative pool. Means that is growth fraction. Proliferative pool means how many cells are remaining that will need to divide. Rate of loss of tumor cells by cell shedding. So how many cells are getting moved from the tumor and spreading? On all this, the rate of growth will depend. How many cells are, suppose when you find a defined area, how many times the cell is dividing, how fast the cell is dividing, how many number of cells are there in the tumor. Suppose 10 cells are there. To become 20, it will take 30 seconds. After some time, what will happen? The tumor is very big, means more number of cells are there. If more number of cells are there, there will be more production of more cells. So the growth of the tumor starts increasing very fast. Another one is called degree of differentiation of the tumor. The rate of growth of malignant tumors is directly proportional to degree of differentiation. What is this degree of differentiation? Degree of differentiation means the difference between a normal cell and cancer cell is very high. Means it is like, see, benign tumor and normal cells are like identical twins. Example. And when you tell about malignant cells, what will happen? The difference between normal cell and cancer cell, you can find huge difference. Huge difference means when you take two twins, both of them looks very similar. Then there's one small mole on the chin. Other than that, both A twin, B twin, both looks similar in all the parameters. That is like benign. What is malignant? Suppose twin A, twin B, two girls are there. The A person will have one mole on the chin and little bit reddish color hair. And like, so much of difference is there to observe between the twins. So then what we tell is they're poorly differentiated. Poorly differentiated means the similarity between the two twins is very less. Are you clear, guys? The degree of similarity is very less. The difference is more. Means what? Between the normal cell and cancer cell, when you observe under a microscope, you will find lot and lot of difference. That means so many number of mutations had happened. The degree of similarity is decreasing. Means the potency of cancer cells to divide is increasing and the changes are so much. So that is degree of differentiation. And they will show very much aggressive growth. Poorly differentiated tumors will show aggressive growth. Okay. Some tumors after a period, they will show very slow growth and may suddenly show spurt in their growth due to development of aggressive clone of malignant cells. So what will happen? For certain point of time, some tumors will grow. At one point of time, they'll stop the growth. And again, the growth may increase when there is more aggressive cells. Means the poorly differentiated cells, more number of mutations have increased. Then now to happen, the aggressiveness will increase. See, initially bad boy is bad boy. He'll go to gym, he will develop so much of muscles and all. He'll become more aggressive and he'll kick you more. The same thing happens to the cancer cells. Ka67 gives an idea on the proliferative index of the tumor in the clinical setting. How you will see how fast it is growing is through the checking the Ka67 of the tumor cells. Cancer phenotype and stem cells. What is this cancer phenotype and stem cells? See, another one I will tell you, I told you about degree of differentiation, right? Some tumors, what will happen is after some time, they'll stop growing. Rarely, a malignant tumor may disappear spontaneously from the primary site, possibly due to necrosis caused by the good immune system attack, okay? Only to reappear as secondary elsewhere in the body. That's what you'll say. Metastasis of unknown origin means I showed you what is primary tumor and secondary. You saw that crab, the center one is the primary tumor, and where it has metastasized, there it will form some cells or some growth, abnormal growth. That is the secondary tumor. So when you diagnose or when you check for cancer, you will see there are some cells in the liver, some cells in the somewhere else. Okay, you will be seeing some other tissue. You would see cancer, but you don't know from where those cells has come. The primary tumor would have disappeared. Some changes. Necrosis means your immune system, when you use immunomodulator, when you use this immune boosters, this therapy, immunotherapies and all, sometimes your body may have more power of your immune system may like be more than your cancer cells power. So what will happen? The cells may die and you don't know. The only secondaries are there, but primary tumor you will not see. Sometimes what will happen means those cells you cannot identify from where they have come. But sometimes you can identify. You will tell these all are secondaries, but this is not a primary tumor. Okay. Another one is cancer phenotype and stem cell. There will be rapid proliferation. That means cancer cells ignore the body's growth controlling signals and proliferate very much uncontrollably. Okay. And immortality. What is this immortality? They evade the death signals, allowing them to achieve immortality. And there will be excessive growth. What is this excessive growth? It is nothing but there is an imbalance between cell proliferation and cell death that is leading to excessive growth. Some cells are forming means some cells should die. But here the it does not match. Dying is less, growing is more. And there's something called as loss of differentiation. What is this loss of differentiation? Means they will lose the ability to perform some specific functions. Okay. And genetic instability. What is this genetic instability? It is nothing but due to loss of this growth controls, cancer cells become genetically unstable and they acquire new mutations. And local invasion. What is this local invasion? They invade and overrun this neighboring tissues. And they have ability to metastasize, means metastasis. These cancer cells, they can travel from the site of origin to the other parts of the body and they establish distant metastasis. What is the word monoclonality? Means cancer cells originate from a clonal proliferation of a single progenitor cell. Okay, from single stem cell, there will be progenitor cells. From that single cell, it will come. That is a monoclonality. What are these cancer stem cells? They arise from stem cells normally present in the tissues. In every tissues, we will have stem cells. So these cancer stem cells will come from those cells. These cells will have properties of prolonged self-renewal. Means if there will be some mutations in those stem cells, what will happen? For long time, prolonged self-renewal they can have. Asymmetric replication. Plasticity means transdifferentiation. Transdifferentiation means they exhibit uncontrolled growth, immortality, loss of specialized function, all these things, genetic instability, invasiveness. See, for stem cells are the one which will help you to produce more and more cells. That's why, even blood cells, you see people collecting stem cells from the mother's womb. When you come out, from your umbilicus cord and all these, they collect your stem cells. These stem cells have the characters of differentiating into any other cells. So what will happen if there is a mutation in such stem cells? What will happen? Stem cells only produce more and more cells. If there is mutation in that, there will be more production of more and more abnormal stem cells that will lead to more and more production of cancer cells. Okay. So that is more dangerous. So nowadays the research is going on targeting these cancer stem cells rather than the proliferating cancer cells. Okay. That's what I told you. Clinical and gross features, this we have seen. Benign tumors and malignant tumors also we have seen. Some benign tumors like subcutaneous lipoma, I told you, right? Small uh, structures that will be present under your skin, hard things, or something growth is there, and those are nothing but subcutaneous lipomas. Meningioma of the nervous system. They produce serious symptoms. And malignant tumors, they grow rapidly, ulcerate on the surface, invade locally into deeper tissues, metastasis, and you will have production of weight loss will be there, anemia will be there in severe cases. What are the cardinal features of malignant tumors? Cardinal feature means very important characteristics of tumor cells. What are the very important characteristics of tumor cells? Invasiveness means ability to go into other tissues. Metastasis means spread. Okay. There's something called as gross terms such as papillary, fungating, infiltrating, ulcerative, cystic, all this. These are like different words that are used to describe the tumor cells. Is it growing in your brains? Okay. First I'll tell you what is the meaning of this clinical features and gross features, okay? Clinical features mean they're observable signs and symptoms and they're experienced by the patient and noted by the healthcare provider. Well, gross features means you will see under there's a macroscopic characteristics, okay, of tissues or organs that can be observed without a microscope. Even if you don't have a microscope, you can see those changes. Okay. Clinical features. See, clinical features refers to the symptoms and signs observed in a patient, okay, and they are associated with a disease or medical condition. They are the characteristics that clinically you can assess when you take or when you examine the patient or when we're doing history taking, you can observe that. See, for cancer, clinical features might include, weight loss, fatigue, pain, lumps or masses that are felt on physical examination, changes in skin appearance, abnormal bleeding, any symptoms reported by the patient or observed during the clinical evaluation. And gross features means they refer to observable characteristics of tissues or organs that you can see with the naked eye, not the microscope, maybe during surgery, autopsy, or when you examine the specimens without the aid of the microscope. So, for example, in cancer, gross features might include the size, the shape, the color, texture of tumor, location, presence of necrosis. Necrosis is nothing but the dead tissue. Or if there is any visible invasion into the surrounding tissues. These changes are often seen when you're doing some surgical procedures or biopsies or pathological examination of the removed tissues. Okay. Hope you are clear till here. Now we'll discuss about these words. What is papillary? What is fungating? All these you should know because these all are the characteristics. Okay. And these gross terms help pathologists and clinicians. These are the terms used. They'll help them understand the physical characteristics of tumors, which can provide important clues about the nature and behavior of the tumor. I was telling you about nature and evaluation. Here it will tell about nature and behavior of the tumor. You see, sarcomas typically have fish flesh like consistency, while carcinomas are firm. What is sarcomas and what is this carcinomas? Okay. Benign tumors, when they become malignant, they are called as carcinomas. Means, if, how to tell you? I'll tell you. See, usually cancers, okay, they have two origin. One is epithelial cell origin and another one is tissue origin. If it is the lining of any tissues, that is epithelial cell origin, or for both of them, There are two origins, okay? One is epithelial cell origin, one is tissue origin. Both of them have benign tumors and malignant tumors. So benign tumors are all called as omas. And if they are epithelial cell origin, if these benign tumors turn into malignant tumors, they are called as carcinomas. And suppose the benign tumors which are originating from the tissue turn into malignancy, they are called as sarcomas. Are you clear? Ka67 is nothing but the proliferative index, how fast the cells are dividing. You will get a value. So based on that, you will tell how fast your cells are dividing, how aggressively you need to give treatment to the patient. Are you clear with the classification, guys? Any doubts? Can you repeat? Okay. Listen clearly, okay? The cells are having cancer cells will originate in two origins, okay? One thing is it can form from the lining of the cells, maybe lining of the lung or lining under the skin, anywhere. The epidermis, the lining, it is called as one kind of tumors, epithelial cell tumors. Another one is called as mesenchymal cells. Epithelial cell origin and mesenchymal cell origin. Epithelial cell origin means like the lining. If the cells in the epithelium gets mutated, they are called as epithelial cell tumors. If something is getting mutated in the tissue, mesenchymal cells, that is nothing but the tissues, they are called as mesenchymal tumors. Whether epithelial cell tumors or mesenchymal cells tumors, you have benign and malignant. All the benign tumors, epithelial cell benign tumors and mesenchymal cell benign tumors, you will end up with the suffix oma, lipoma, oma. Okay? Oma is benign. When epithelial cell tumors will become malignant, they are called as carcinomas. When the benign tumors of mesenchymal origin become malignant, they are called as sarcomas. Are you clear? Did you understand? Joe Paul Wilson, do you understand? Okay, good. See, papillary thyroid cancer. I'll tell you what is this word papillary means. It refers to the tumors look like finger-like projections. They can be seen with the naked eye. So we call them as papillary thyroid cancers. They often have branching and frond-like appearance. And what is the word fungating? Okay. Fungating means fungus-like. See here, fungating mass on the dorsum of left foot. It is nothing but recurrence metastatic melanoma. What is this fungating? So it will have a mushroom-like or cauliflower-like growth pattern. They often grow rapidly and irregularly, protruding above the surface of the tissue. See here, above the surface of the tissue. And what is this infiltrating? Infiltration means they invade and spread to the surrounding tissues. Okay. They are not remaining to the confined origin, but they spread into the adjacent areas. Next one is hemorrhagic tumor, that is colorectal cancer. Example. So, it indicates the presence of bleeding within the tumor. Hemorrhagic tumors, they have areas of blood accumulation, which can appear as dark red or black regions within the mass. And next one is ulcerative, where the surface of the tumor cells break down, forming sores or ulcers. They may appear as crater-like lesions with necrotic tissue. And cystic tumor means it contains cysts which are fluid fill like sacs. See here, that is called a cystic. So when a tumor looks like this, you give different names to tell. Okay, this is the fungating tumor. It is looking like appearance, just to describe. Okay. See, these terms will help the pathologists and clinicians describe the physical characteristics of tumor. So these things will provide some important clues about the nature and behavior of the cancer. So what are these microscopic features? They are very important characteristic for classifying the tumors. That is microscopic pattern. What is this microscopic pattern? The epithelial cell tumors, they generally consist of acinal, like sheets, columns, parts of epithelial tumor cells. They may be arranged in solid or papillary pattern. These are nothing but epithelial cells, okay? How they will be arranged. How these epithelial cells will look when you're seeing under a microscope, okay? Next one is cytomorphology of neoplastic cells. What is the cytomorphology? Differentiation and anaplasia. I told you what is differentiation. Poorly differentiated tumors and you will understand. I'll explain you. See, cytomorphology, tumor angiogenesis, and inflammatory reaction. So I told you epithelial cell tumors. One second, guys. Just pause for 1 minute. Okay. I just wanted to breathe. Microscopic pattern, the epithelial tumors, they consist of acini sheets, columns, or cords of epithelial cells that may be arranged in solid or papillary pattern. Mesenchymal tumors, they are arranged like interlacing bundles, fascicles, or whorls lying separated from each other and by the intracellular matrix. Okay. See here. Benign epithelial cell tumors, fibroadenoma of breast, and malignant epithelial cell. So how it is looking? Ductal carcinoma of breast. Fibroadenoma means it is to a just sticking in one place. When it becomes malignant, what is happening? The adenoma, benign tumor, carcinoma, it is malignant tumor. I think now you understood the difference, the classification you would have understood by now. Did you understand now? Benign tumor originating from the epithelial cells is called as oma. When it is becomes malignant, you will call it as carcinoma. Hope you understood now the classification better. Okay. See, benign mesenchymal tumors means which are coming in tissues. Leiomyoma of uterus. When it becomes malignant characteristic, same mesenchymal origin, it is called as leiomyosarcoma of uterus. Differentiation and anaplasia. What is this differentiation? Extent of morphological and functional resemblance of parenchymal tumor cells to corresponding normal cells. That's what I told you. The degree of similarity between normal cells and cancer cells is called as differentiation. How much close they are. Means if they're looking very much similar, they are called as well-differentiated tumors. Means the degree of difference is less, similarity is more. Moderately differentiated means grade 2 tumors. Means the difference is more when compared to well-differentiated tumors with normal cells. And poorly differentiated tumors, the difference is high. Similarity is very less. And when you talk about undifferentiated tumors, they are completely very much different. See, grade 1, grade 2, grade 3, grade 4. When you see normal cells with these cells, what will happen? Almost they look little bit similar. Moderately differentiated, more changes with normal cells. See here, see here. And when you see poorly differentiated, see the nucleus and all. Here the nucleus, you see, they look similar. Here, change. Grade 3, more change. Undifferentiated tumors, completely changed. Now you understood how the tumor looks. More number of changes, undifferentiated and grade 4. Clear, guys? Are you clear with this? Yes or no? Yes? Okay. And what is anaplasia? Anaplasia is nothing but the loss of mature or specialized features of a cell or a tissue. Means lack of differentiation and is a characteristic feature of malignant tumors. See, poorly differentiated tumors means which do not look like normal cells or not. They have so much of difference. They have high degree of anaplasia. Okay. Means they have lost all the characteristics of a normal cell. How much the kid have spoiled means you cannot even search for a single point to tell he is good. He's become worst. You know, rowdy gunda, has become a terrorist. So you cannot tell he's good. That many changes have happened. There's no normal behavior at all. The worst behavior. That is anaplastic kid. Means poorly differentiated. At least you will not find one single character where you can tell, okay, you can show some mercy. Crossed all his limits. Poorly differentiated. Morphological and functional alterations in the neoplastic cells are seen as a result of anaplasia. Okay. So what is these tumors? They have so many characteristics. Okay. Understood? Why is this picture man in between? Guys, tell me what you can understand from this. What did you guys observe? We need some break, no? Tell me. Why did ma'am keep this one? Come on, guys. Both are healthy. Muscle loss and lean body. Nothing, man. If you do exercise, eat good, stay good, you will have a healthy life. We don't need all the changes. Whatever you have read till now and all, okay? For that, you'll have to be good from your young age. So you will be smiling at your old age. We need some icebreaker in between, no? Something is boring. Even grandfather looks handsome like him. Yes or no? Always technical language, madam. Huh? Yes. So, when you are young, if you take care of yourself happy with minimal changes in your cells, you will stay happy and smiling even at your old age. Okay? Keep yourself fit and healthy. So, microscopic features. I was telling you that so many changes will happen. What are all the changes? See, basal polarity, you know, basal polarity means see here, nothing but there will be loss of basal polarity in a cancer cell. I was telling you, so many changes will happen in a bad idiot, a good guy. So many changes happen. 10 out of 10 score, you become the worst. So if all these changes takes place, This is a good boy characters. This is bad boy characters. Like how many good characters have become bad? More number of bad characters, poorly differentiated tumors, high degree of anaplasia. Now I think you're very clear. Yes or no? Oh, you're telling, madam, you're telling changes, changes, changes. What are all these changes? These are the changes. Okay. What is this loss of basal polarity? See, normally the nuclei of epithelial cells are oriented along the basement membrane. Okay. Which is termed as basal polarity. This property is based on cell adhesion molecules. Okay. Particularly something called as selectins and all. Selectins. In early in malignancy, when the tumor cells are forming, they lose their basal polarity. Initially, the changes start here. They lose their basal polarity so that the nuclei they'll come from the away from the basement membrane towards the center. See here, they're moving. Next one is pleomorphism. Pleomorphism means variation in size and shape of the tumor cells. See how it is. How see here, the size and shape is changing. That is degree of anaplasia. How the cell is changing. The degree is getting more. And tumor cells are often bigger than the normal cells. See here the normal cell size and the cancer cell size. They're bigger. Next one is nucleus to cytoplasmic ratio. There will be disproportionate cell size and nucleocytoplasmic ratio is increased. See here. Here cytoplasm is more. Nucleus is small. Nucleus to cytoplasmic ratio. Small number by big number. Here the number is increased. So nucleus by cytoplasmic ratio is increasing. Next one is anisonucleosis. What is this anisonucleosis? It's nothing but variation in size and shape of the nuclei in this malignant tumor cells. And there's something called as hyperchromatism. What is this hyperchromatism? Nuclear chromatin of these malignant cells is increasing and is clumped. Okay, here you can see. Next one is nucleolar changes. What is this nucleolar changes? They have prominent nucleolus or nucleoli in the nucleus, and there will be so much of nuclear protein synthesis. And tumor giant cells. What is this tumor giant cell? See here. There will be multinucleate tumor giant cells containing a single large and desired nucleus. Okay, that is what tumor giant cells. Next one is mitotic figures. What are these mitotic figures? Mitotic figures are nothing but these parenchymal cells of these poorly differentiated tumors. They show large number of mitosis when compared to benign tumors. Okay. Next one is functional or cytoplasmic changes. What is this functional or cytoplasmic changes? Structural anaplasia in tumors is accompanied with functional anaplasia. Okay. That is from the constituents of cytoplasmic cells. The functional abnormality will be quantitative, qualitative, or both. Okay. In multiple myeloma and all, abnormal immunoglobulin will be produced. All these things are functional changes that will happen. Next one is DNA aneuploid. Aneuploid you can see here. The ploidy will change. Hope you are clear. You can read through the textbook. You can understand it more better. If any doubts, you can get back to me. Okay. Clear, guys? When you read it, you will understand. These chromosomal abnormalities, okay, what will happen is all tumor cells have abnormal genetic composition. So because of this abnormal genetic composition, even the dividing cells also will have so much of abnormalities. That's what I told you, multiple mutations. Are you clear till here? Yes or no? If you reply me, we'll go friend. We'll go ahead. So these are all the characteristics which I've explained you. You can read through the table. Next one is tumor angiogenesis and stroma. I told you, right? Even the cancer cells need blood supply. So there should be so much of tumor angiogenesis means new blood vessels are formed to provide nourishment to the growing tumor. What is called as microvascular density. Means newer capillaries will add to the vascular density of the tumor, which will assess the rate of growth of tumors. When there is more and more blood vessels that are supplying to the tumor, what will happen? More and more growth of tumor cells will be there. So that's why you will have some drugs which will block the blood supply to the tumor. This is called angiogenesis inhibitors. Okay, next one is central necrosis. What is the central necrosis? When the tumor will outgrow its blood supply. So what will happen? The blood supply will not be there into the center of the tumor. So what will happen when there is no oxygen and nutrients? The cells will become necrotic. And so the central necrosis will happen. Okay, when there is loss, when angiogenesis fades, when the blood cells cannot divide and then produce. Okay, that is tumor angiogenesis and stroma. Tumor stroma is nothing but the collagenous tissue in the stroma may be scanty or excessive. Means if it is scanty means it's soft and fleshy. If it is excessive means it is hard and gritty. And another one is you can see a growth of fibrous tissue in tumor is stimulated by basic fibroblast growth factors. And what you call as medullary and serous. Medullary tumors and serous tumors. Medullary means epithelial tumor is majorly composed of parenchymal cells. So medullary carcinoma of breast, medullary carcinoma of the thyroid, you will call them. If the composition of the parenchymal cells is more than the stroma, then you call it as medullary. And when you call it as serous means there is so much of blood vessels, angiogenesis. That is called as serous tumors. Means infiltrating ductal carcinoma of breast. Parenchymal cells are less serous. So many parenchymal cells are more, it is medullary. Okay. Clear till here, guys? This is all nothing but the terminology that is used to describe these cancer cells. Okay. And the nature of the tumor. Medullary tumors, serous tumors. Medullary tumor means what? So much of cancer cells are there, but blood supply is less. When you call it a serous tumors, blood supply is more and parenchymal cells are less. Did you understand? Okay. Yes or no? This is just to describe the characteristic of tumor, that's all. How you will tell no? Worst fellow, bad fellow, terrorist, murderer, all these different words that you use depending on different types of bad character. Are you guys there? Tell me yes or no, then I'll go to next slide. Last point we'll discuss, okay? I will not extend the class so much. Inflammatory reaction. What is this inflammatory reaction? Usually it is present around the tumors, that is as a result of ulceration. Because there will be ulceration means there is so much of ulcer kind of thing that is forming, there will be inflammation around. You know, when there's ulcers, when it's damaged, there will be inflammation. That is that one. If the inflammation may be acute or chronic. Okay, some tumors show chronic inflammatory reaction, maybe of lymphocytes, plasma cells, macrophages. In some instances, it's a granulomatous reaction when there is no ulceration. Okay, this is due to cell-mediated immunological response by the host. So when you have cell-mediated response, because it want to destroy the tumor cells, at that time you will see the inflammation. Okay, like malignant melanoma of the skin, all this, seminoma of testis, all this. Okay, so we'll deal with this in next class. Please read it basic and come. This is very interesting. Now the class will be little bit of practical. Okay, the further classes. Little bit of you will get hands-on experience of how to. I'll make you understand practically how you will understand cancer cells. Okay, through some examples. Next class will be more interesting if you learn and come. You want me to continue or we'll have it in next class? Please read Harshmohan textbook and come. It's very clean and clear. You will understand. You have any doubts, you post me in the group. Shall we close the class for now? Good night. No doubts? Harsh Mohan, pathophysiology. Why it is difficult to treat? See, why it is difficult to treat means it is difficult to kill the terrorist when they come and occupy all, if they're only occupying the border or if they're only sitting in Kashmir, easy to kill. If they come to Hyderabad, if they come to Anantapur, they'll go to Tamil Nadu, Kerala. How will you trace them multiple places? It is difficult, right? We need so much of how much of pressure we keep keeping also. They keep on killing from different sides. So our ability to fight will become decrease, it'll you have to give more and more efforts to kill them. The same thing with cancer. Vip, did you understand Vip now? Huh. Any other doubts, guys? If not, good night. Please go through the classes. You don't check what is the, what ma'am is teaching in this order and all. Learn the way I teach, you'll understand it, okay? But you need to put your efforts from your side. Okay, very good question, Mubashira. I will tell you. Why is there recurrence, ma'am, if the cycles is completed? See, I told you you are giving treatment to cancer patients and you are killing the cancer cells. There is something called as cancer stem cells. Anytime they can reverse and then they can produce their more cancer stem cells, and from cancer stem cells you will start getting cancer cell production. Anytime they can recover, unless when your immune system goes down, they come back and give you cancer. Or sometimes after surgery, one or two cells would have been left that would have been growing in cancers. Even in the PET scan and all, with very little amount of cancer cells cannot be detected. Maybe that have been present there sitting in some organ sleeping, they would have woken up. Mubashira, did you understand? You're killing cancer cells, you're not killing cancer stem cells. Hmm. Not only that reason, another reason is like more cells, other cells would have got mutated in the process. That time also that will happen. Any other doubts? Triple positive, triple negative means triple positive means I'll tell you in simple words. Triple negative is difficult to treat when compared to triple positive. I'll tell you the reason. See, when you know the cause, you know why people died. Because Pakistan people put the bombs. You will go and kill those people. Okay, in simple reason. You don't know whether Nepali did it, some other China did it, or Russia did it, but somebody is killed. When you don't know who did it, you cannot fight. You will just do trial and error. The same thing for the growth of the tissues of the breast, you need estrogen receptors, progesterone receptors, and HER2 receptors. When you do a reason, when you see these mutation is there in ER receptor means estrogen receptor positive. Means you know the reason why there is breast cancer for you. So it's very easy to target ER, estrogen receptor. If it is because of the progesterone receptor, the these all are the things that are responsible for the growth of the breast tissue. If you find any abnormality in any of this, you have the targeted therapies, you can treat them. When you don't know which is the cause, means negative, how can you treat? Which one you'll go and target? Understood? Are you clear? Triple, it's not aggressive, difficult to treat is triple negative. Aggressiveness is another concept, how fast the cells will divide. Clear? Shall we close the session? Good night.